very often involved with workplace bullying. I would say about 1 in 6, perhaps 1 in 5 people that I see somehow describe significant events at work that have either triggered or increased their mental distress. So it's a very common occurrence. We live in a very competitive environment in London, particularly, where emotions are running high. Sometimes it's a testosterone infused environment where there's a lot of competition between people, and that can go the wrong way, and people can be severely emotionally affected by this. So when that happens, I will obviously take note of that. I will try to relate it to people's presentation. Often people don't realize that their workplace stress or even bullying has contributed to their mental health problems. They might even not make the link between the two. So it's important to really make the link in the first place. Once we've established that link, then we can start doing something together about it. And what I often like to say is the first thing that they should do is raise it with their employer. And there's lots and lots of ways of doing this. Sometimes people are scared about it. Sometimes it just requires a conversation with their boss. And a friendly conversation, and the boss may not be aware that they're actually causing them a bullying feeling. And it's surprising how that has often resolved the problem. If the problem is more severe, then I can come in as a mental health practitioner, and I can advocate on the behalf of the patient if the patient wishes me to do so with their consent. And I can also advise the employer and their occupational health department of how to help the patient overcome any stress that may have been associated with workplace difficulties. It's not only bullying, but other difficulties that may arise. And also help people that come to me to say they need to leave their work. So some people say it's impossible for me to stay in their workplace, and surprisingly, when we start treating the mental health condition, when we start facilitating perhaps a conversation with their consent with their employer, it's often that they're able to maintain or even thrive in the position that they felt they had to leave. So I think it's always good to see us about it, and it's good to raise it with us, and we're there to help.